Hello everyone, let us discuss about the drug interactions. First of all, what is drug interaction? A drug interaction is a change in the action, a change in its pharmacological action which can become a side effect that is caused by co-administration, which is nothing but concomitant administration with a food, beverage, supplement or another drug. Every time a drug is administered with other prescription medicine, OTC medicine or food item or herb, we expose ourselves to the risk of potential dangerous interactions. The risk of drug interaction increases with the number of drugs used and is very common in polypharmacy. The drug whose activity is affected by such interactions is called as object drug. The drug whose activity is affected by such interactions is called as object drug, and the agent which precipitates such interaction is called as precipitant drug. As we have discussed earlier, drug interactions can be with other drug, or it can be with a beverage or food, or it can be due to diseased states. Hence, drug interactions are mostly undesirable. Rarely they are desirable or beneficial. An example for that is enhancement of the activity of penicillin when administered with probenecid. Coming to the causes of drug interactions, main factors contributing to drug interactions are multiple drug therapy, multiple prescribers, multiple pharmacological effects of a drug, multiple diseases or illnesses, poor patient compliance, advancing age of the patient, and other drug-related factors. Apart from the above mentioned factors, inter-individual susceptibility to drug interactions may be influenced by a wide range of factors including but are not limited to the following. Those can be genetic, age, gender, disease state, social, dietary, and in some cases being overweight can also be a factor. Now, coming to the classification of drug interactions. The drug interactions can be classified as drug-drug interactions, drug-herb interactions, drug-food interactions, and drug and diseased state interactions. Now, coming to mechanisms of drug interactions. There can be various mechanisms. Let us discuss few. Behavioral drug interaction, which is nothing but altered compliance. Compliance is the strict routine that we follow for the administration of drug. Altered compliance, when one drug alters the patient's behavior to modify compliance with another drug, that is nothing but behavioral drug interactions or simply altered compliance. For example, a depressed patient taking an antidepressant drug may become more compliant to the drug as the symptoms improve. Next is pharmaceutic drug interactions. It is a physicochemical interaction that occurs when the drugs are mixed with IV infusions, causing precipitation or inactivation of active principles before it is administered. The pharmaceutic drug interactions, they occur outside the body. It is a physicochemical interaction between two drugs when they are mixed with IV infusions, causing precipitation or inactivation of active principles of one particular drug. For example, precipitation of sodium thiopentone with an intravenous dose. Whenever it is administered through IV route, it gets precipitated. Next, coming to pharmacokinetic drug interactions. They mainly occur due to the altered concentration which leads to altered effect. These interactions occur when one drug changes the systemic concentration of another drug, altering how much or how long it is to be present at the site of action. When two drugs are used together, their effects can be additive or opposing. Additive results in synergistic action, which is nothing but when you combine two drugs, it leads to larger effect than expected. When the actions are or effects are opposing, it leads to antagonistic effect, which is nothing but combining two drugs leads to smaller effect than expected. And there is sometimes confusion on whether the drugs are synergistic or additive, since the individual effects of each drug may vary from patient to patient. And in some cases, the synergistic interaction may be beneficial for patients, but it also increases the risk of overdose. And both synergy and antagonism can occur during different phases. In certain instances, both synergy and antagonism both can occur during the different phases of interaction between a drug and an organism. Now, the pharmacodynamic interactions can occur on, firstly, pharmacological receptors. The receptor interactions are the most easily defined, but they are also the most common. From a pharmacodynamic perspective, two drugs can be considered to be homodynamic or heterodynamic. Homodynamic means if they act on the same receptor, they in turn can be pure agonist, partial agonist, or antagonist. Next is heterodynamic, that is, they act as competitors if they act on distinct receptors. Interaction can occur at the pharmacodynamic interactions can occur at signal transduction pathways also. These are molecular processes. The signal transduction mechanisms are molecular processes that commence after the interaction of the drug with the receptor. For example, it is known that hypoglycemia, which is nothing but low blood glucose level in an organism, produces a release of catecholamines. These catecholamines, they trigger compensation mechanisms, thereby increasing the blood glucose levels. And the release of catecholamines also triggers a series of symptoms which allows the organism to recognize what is happening and which act as a stimulant for preventive action, that is from eating sugars. Next category of pharmacodynamic interactions is antagonic physiological systems. An actual example of this interaction is found in the co-administration of digoxin and furosemide. Digoxin, which is a cardiac glycoside, it acts on cardiac fibers and its effect is increased if there are low levels of potassium in blood plasma. Remember, the effects of digoxin are increased if low levels of potassium are present in blood plasma. Whereas coming to furosemide is a diuretic. It lowers the arterial tension by favoring the loss of potassium. So furosemide leads to low levels of potassium. This could lead to hypokalemia, which could increase the toxicity of digoxin because the effects of digoxin are enhanced in low levels of potassium. Furosemide causes hypokalemia, which could increase the toxicity of digoxin. This is an example of antagonistic physiological systems. Now coming to pharmacokinetic interactions. The pharmacokinetic interactions, they mainly occur due to the changes in the concentration, drug concentration at the site of action or within the body. And these modifications in the effect of drug are caused by differences in the absorption, transport, distribution, metabolism or excretion of one or both of the drugs compared with the expected behavior of each drug when it is taken individually. Now coming to absorption interactions, which are a type of pharmacokinetic interactions. In simple terms, absorption interactions are nothing but by the co-administration of two drugs, absorption of one of the drug or sometimes both drugs are altered. They are nothing but absorption interactions. Some drugs such as prokinetic agents, they increase the speed with which a substance passes through the intestine. And if a drug is present in the digestive tract's absorption zone for less time, by the administration of prokinetic agents, the time in the intestine is reduced for some other drugs. And if the drug present in the digestive tract's absorption zone for less time, its blood concentrations will decrease and simultaneously its absorption and pharmacological effect will be altered. Opposite will occur when the drugs that decrease intestinal motility. Certain drugs that decrease the intestinal motility. The absorption of some drugs can be altered drastically reduced if they are administered together with the food with high fat content. For example, administration of oral anticoagulants and avocado along with high fat content food reduces their absorption. Now coming to transport and distribution interactions. They mainly occur due to competition for plasma proteins. In these cases, two drugs they have same binding affinity for particular plasma protein, and the drug that comes first binds with the plasma protein, leaving the other drug dissolved or free in the plasma, which alters its pharmacological action. Warfarin is a major example for protein transport interaction. It binds with albumin and it alters the absorption of other drugs that bind with albumin. Next, coming to metabolism interactions. Many drug interactions are due to alterations in the drug metabolism. Further, human drug metabolizing enzymes are typically activated through engagement of nuclear receptors. One notable system involved in metabolic drug interaction is the enzyme system comprising cytochrome P450 oxidases. This is very important, cytochrome P450 oxidases. This is the most notable system involved in metabolism interactions. CYP450. CYP450 is a very large family of heme proteins that are characterized by their enzymatic activity and their role in the metabolism of large number of drugs. Of the various families that are present in human beings, the most interesting in this respect are 1, 2 and 3. And the most important enzymes are CYP1A2, CYP2C9, CYP2C19, CYP2D6, CYP2E1 and CYP3A4. As a result of these interactions, the function of enzymes can be either stimulated, which is nothing but enzymatic induction, or can be inhibited, which is nothing but enzymatic inhibition. First of all, coming to enzymatic inhibition. If a drug A is metabolized by CYP450 enzyme and drug B inhibits or decreases the enzyme activity, then drug A will remain with high levels in the plasma for longer time as its inactivation is slower. As a result of enzymatic inhibition, increase in the drug effect results, which can lead to toxicity. Now coming to enzymatic induction. If drug A is metabolized by CYP450 enzyme and drug B induces or increases the enzymatic activity, then the blood plasma levels of drug A will quickly fall as a result of inactivation, and its inactivation will take place more rapidly. As a result of enzymatic induction, decrease in the overall drug effect occurs, which is nothing but reduced pharmacological action results in enzymatic induction because the drug is rapidly removed from the body. Thank you for watching. Please subscribe for further videos on pharmaceutical sciences and other related disciplines.